10 years ago, I attended a conference on cervical cancer. And one of the conclusions was that the survival is up to 90%, so we're doing pretty well among these women. But when I was listening to those successful results, I was wondering what the quality of life would be for these women ending up after treatment without uterus or without ovaries. And that's actually where my hobby started. And it was 10 years ago, and I thought we have to do something for women, for quality of life, when survival increases after cancer treatment, that they can have children after treatment. So I started with research in literature on transplanting a uterus, but there were a few attempts and with little or no results, and with very narrow therapeutic window. But then I ended up with the ovaries. And the ovaries have a broad indication, and you can apply it to many women in different ways. And that's where I focused my work on. I focused more and more my work on saving fertility, saving the ovaries, in especially young female cancer patients. Because when we look at the ovary tissue, it's very special tissue. It has unique characteristics. For example, when you look at the monthly ovulation and you look at the tissue right away, it really looks devastating. And when you look after a few days, it really looks new again. So let's take you through the wonder world of the female genital organs. Having a child wish is the most primal feeling in women. And it's their role and responsibility to create offspring. But as a gynaecologist, when I'm on a social meeting or social event, and you meet people you hardly know, it's all about fertility, pregnancy, delivery. So if you want it or not, or if you know the person or not, you're right into his personal delivery story, knowing all the details, whether you like it or not. So that's very special, and it's very remarkable that fertility plays a very important role in women. But in a way, it's restricted because we're confined to the biological clock. And why is that? Women are born with a large amount of premature oocytes in both ovaries. And when we enter puberty, every month there will be an ovulation, and there will be oocytes lost in ovulation and becoming pregnant or not. But eventually, the decrease in oocyte stock will decrease till menopause, and it will end up in a postmenopausal state when there are no oocytes left anymore in the ovaries. And it's a decrease in fertility, a decrease in the amount of oocytes, and also a decrease in the quality of oocytes. So for example, when you take the age of 35, you will have a 50% decrease in fertility rate and fertility possibilities. Okay, can I have the next slide, please? So when we take the fertile period into account for having children, there are a few options I want to talk with you. They're all given in the left ovary. So I'll start with a normal pregnancy. The normal pregnancy accounts for 80% of the children being born. And standing here, I will promote the early pregnancy, because what we see is motherhood is delayed because of career, all other sort of plans. But it's squeezed into the working life, and now the age when mothers get their first child in Holland is 29.5 years old. There are some risks of delaying your pregnancy because, for example, the biological medical risks, the obstetric risks of having, for example, higher chance of having preeclampsia. But also, and not much people know it, you have a remarkable increase in breast cancer when you delay your first pregnancy. Also for the children, there's the congenital and physical aspects when you delay your pregnancy. So there are a lot of risks about delaying pregnancy and not known by all the people, for example, here sitting here, but also for the doctors itself. They don't know the risks to communicate to the patients. So it's very important to get awareness of these facts. When spontaneous pregnancy isn't nature and it goes not very easy, you can do IVF, in vitro fertilization, everyone knows probably, where you can fertilize an oocyte with a sperm cell into the laboratory setting. then the embryo will be placed back into the uterus. That accounts for almost now 20% of all pregnancies. And it's almost general practice when you are a fertility doctor in the hospital. When the other options for getting pregnant in the fertile period is when the donor, with donor's semen or donor eggs or surrogacy, all possibilities when the quality is inferior. And the technique we use is always by ICSI, so putting the sperm cell into the egg cell, and then there will be an embryo developing. These are all techniques in the fertile period to get pregnant spontaneously or with some help. But when we have to save fertility for other reasons, and we have to delay fertility for other reasons, like for medical reasons, but also for social indications, we have to freeze the essentials. And I will go to this and take you to the right ovary, lucky we have to share with you the options you have for freezing the tissue. Freezing the tissue, the main indication for this, and that's also where my work started, is to save the fertility for young cancer patients. When they will receive chemotherapy or radiotherapy, the ovaries will get damaged so much that the patient after treatment will, in most of the times, get into a postmenopausal state afterwards. So there is no possibility to get pregnant anymore. But when you freeze the essentials before treatment, you can have a child wish afterwards. One option to do this is to freeze embryos. That's like the IVF procedure. It's almost the same, but you don't transplant it directly into the uterus, but you save it in the freezer in -196 degrees for an indefinite period of time. So it can stay there. If the patient recovers and has a good prognosis and wants to have children afterwards, you can thaw the tissue and replace it back in the uterus. A new technique, fairly new, we just performed the technique over 1 or 2 years here in the Netherlands, is freezing the oocytes. And freezing the oocytes is more difficult than freezing semen. Freezing semen has been done for over years for the male cancer patients, but freezing oocytes is much more difficult because the interior of the oocytes is more vulnerable to freezing. But nowadays we have a special freezing technique where we do it very quickly. It's called vitrification, where we freeze the oocyte very quickly, and the interior of the oocyte will stay in the right way. That's also a procedure you can offer to cancer patients, but also there's a lot of discussion going on. You can use it for a social indication. When you want to delay, as a woman, your pregnancy or your child wish, you can freeze your oocytes. Another thing you can save fertility or preserve fertility is when you don't have the time to freeze oocytes or embryos, because that takes a couple of weeks to make them and to freeze them. But if you don't have the time and a cancer patient has to start with chemotherapy right away, you can freeze the ovary tissue. And what we do, we perform a laparoscopy, remove one ovary, cut it into very little slices, and we freeze the slices into the freezer, and there it can stay for an indefinite period of time. And also, when the woman has had her therapy and wants to have a child wish, wants to have children, but is in a postmenopausal state, you can replace the ovary tissue. Here you can see that the ovary tissue is being cut, and thereafter, when you thaw it, you can replace the ovary tissue in the ovary that's left in the body but doesn't work anymore. And when you replace the thawed tissue, the ovary will eventually work, and you will get your ovulation, you will get your menstrual cycle, and eventually you can get pregnant with it. So that's, in the beginning I told you the ovary tissue is very special, but it's remarkable of the tissue because you transplant it you put it in the ovary left, and it's just going to function. So that's really a successful and promising therapy for fertility preservation. Worldwide, there are only 15 babies born with this technique, so it's still experimental. In 2003, we performed at the Leiden University Medical Center the first transplantation of an ovary. That was also for fertility preservation because it was a cervical cancer patient who got radiotherapy on the pelvic region. So when you got radiotherapy on the pelvic region, the ovaries will get damaged. So before starting the therapy, you have to remove the ovary. And we thought we had to remove the ovary to the upper arm. We put the ovary to the left arm, and as I will show you, we did this end-to-side anastomosis to the vessels there, and the ovary stayed there and functioned there for over years. So that's also a new kind of therapy and possibility to save fertility in especially cancer patients. So there are a lot of possibilities, and here you see that you can remove the ovary to the upper abdomen region when you have radiotherapy in the pelvic region and you want to preserve the ovary in a more conventional way. So there are a lot of fertility regimens you can use for saving fertility. But when we go along these options and take the biological clock on the background, there are a few considerations I want to share with you. First of all, there's the biological clock and the different aspects of fertility. And we're very lucky, thank you Edith, we're very lucky to have our, we are sort of, in the female emancipation, we have our role and we can determine our role in being a woman, being a mother, or what we want in life. So that's from start on very important, and we can compare it with when the oral contraception was introduced in the late 60s, 70s. That was a sort of same. Now you can freeze your oocytes when you want to escape the biological clock. So that makes a woman more, that creates more awareness and giving direction in your personal mission. But when you look at the spontaneous pregnancy and the pregnancy for when we postpone motherhood, as I told you before, I would promote in this, among these women here today, the young motherhood again. Because when we look at the medical and biological consequences of delaying motherhood and the risks that we have by delaying it, it's very important to get more conscious and to get more aware of these things to promote young mothers again. When we look at the other things, when a woman wants to have her career and wants to spend her time on other things and is really self-conscious of what she wants, then she can freeze her oocytes. But then again, I want to stress that you have to freeze your oocytes before 30 because they're much more better quality. So the therapy will be much more effective. So it's the same story. Try to tell everyone and try to be aware what are the, and try to give the right information to all the women, what they want and what the possibilities are. We also have the elder women, like in the beginning of last year, a 63-year-old woman who terribly wanted to have a child. And she went to Italy with donor eggs and donor semen. She got pregnant and she gave birth to a healthy baby. But how far are we going with fertility options? And can we challenge nature in this way? For cancer patients, it's almost like you have to give them information about fertility preservation before therapy starts. And we have to do that more and more. The awareness has to grow because you want every female cancer patient to have the choice for preserving fertility or not. And then I find it a responsibility as a doctor to think about the prognosis and the survival of the patients, to talk with them about it and take that into account when you want to save the fertility. And a very special area is when young girls are confronted with cancer. Luckily, we have now the freezing of the ovary tissue because they don't have a partner, they don't have oocytes yet to pick up. So it's really the only thing you can do with those young girls is to freeze the ovary tissue. And not only for having children in a later phase in life, but the new idea where I'm working on is to use also these tissues during puberty to get a normal female sexual characteristic development. And that's very important for those young girls. So taking the fertility into account, and when reflecting on fertility, we first have to reflect on ourselves. Who am I? What do I want in life? Do I trail a personal mission? And do I respect nature, and in what way? Creating awareness and giving yourself the answers along the way will create more consciousness and will be a personal guide in your fertility as a personal guide in your life. Gratitude is my attitude. Thank you.